Good morning and welcome again to another podcast from Odell Technology. Today we're lucky enough to be joined by Alice Montgomery-Reed, the head of FutureNHS. Hello, Alice.
Hi, morning, Stephen.
Good to see you, and thank you for joining us again. Alice, I'd like it if you could explain to the audience your background, your professional background, and how you ended up where you are today, please.
Sure. So this October I'm coming up to my 10-year anniversary in the NHS with NHS England, which I feel very, very fortunate about. And it's been a kind of a great 10-year career so far for me. I suppose I started out I studied events management in my university degree, and that was in Birmingham. And from then I came into the NHS, and I was really fortunate to join a team working in a sort of network development program where we supported the very early stages of networks and cross collaboration working in the NHS. And I specifically supported a program, a clinical peer support program, where clinicians were matched together on a peer-to-peer program to help with their kind of clinical and professional development. And that was a really, really great experience for me very early on in my NHS career. And I had a fantastic team and a fantastic female boss, and something that I can talk about more about, the kind of female element. I then since kind of moved around the NHS and NHS England, and I moved into the events management space. So actually using my degree and what I trained in events management, and I had some great experiences there, organising some big events, going around the country, having stands, organising speaking presences, meeting lots of people. Really, really great, that job. And we're organising one of our big events, which was the NHS Innovation Expo, as it was known at the time. It's since now become the NHS Confed Expo, as two large events in the health calendar have joined forces together. So that was great. It's one of the kind of really biggest events, a really great experience to work on. Lots of senior healthcare leaders came, often the Secretary of State. You heard from lots of different areas of the NHS and lots of innovations, and it was a great event to be sharing all of that good work. I'm now head of FutureNHS, and I've been in the FutureNHS team this is coming into my 5th year now. So I've moved into more of the kind of digital networking, virtual collaboration world, and I'm in a position now where I look after and I lead a team of roughly 10 people, and it's a team who look after a collaboration platform. So FutureNHS, it's a virtual collaboration platform that supports hundreds of thousands of people across the NHS and wider health and care system to work better together in a virtual way.
Alice, I'm actually a member of the collaboration myself, and I'm privileged enough to see a lot of conversations that go on. I think you've got 350,000 people on the collaboration.
Yes, and growing.
Yes, immensely. And I can see why, because there's been a lot of the groups that I belong to, there's a lot of worthwhile conversations about improvement, about ideas, and how people have improved the services they're doing, some of the issues and some of the barriers that they've come up against at times. Tell me, it's growing rapidly. What do you think it is about the particular service you're providing that is encompassing all the NHS? Why do you think a lot of NHS staff are going to it?
FutureNHS, it started, so it's been around since towards the kind of back end of 2016, 2017. So we've been around for a reasonably long amount of time, and we have been growing. And we have some really, really core principles at the heart of what we do, which support people to do what they need to do. And a lot of that is around, we are being very member-led. So what we do is driven by what the members want. People can use it if they want to. They're not told they have to. It's not a corporate tool they need to use. They can see the benefits and they can see how it can support them. It's funded centrally, so people can come on, they can use it for free. They don't need to pay anything, and they have myself and my team, a wraparound support team that can help them get everything they need to do and do that as quickly as possible. There are also many issues with regards to IT infrastructure that we often experience across the NHS, where a lot of that is fragmented and disjointed. And FutureNHS breaks down those fragmented IT barriers that you get, restrictions, security restrictions, access restrictions, where actually we've developed one online community where you can register if you're working in health and care. You can register, you can come on, you can be verified, and you can join this massive community. And it's one of the largest online health communities that there is out there. And you can communicate and collaborate with other colleagues. You can find access to information. You can contribute to the knowledge and learning that's on there. And we provide that in a simple way. And I think there's just such an attraction to people to be able to do something so simply. And I think we saw a lot of the benefit through the COVID-19 pandemic. And I actually don't know what the health system would have done if there wasn't FutureNHS in place. I honestly think that really, really, really helped accelerate and sped up our response to the pandemic, because as soon as that came along, communities and teams and programs are able to come to us. They were able to set up a new workspace, and that's a new community of people coming together online. They were able to do that. We immediately adapted how we worked, our support. We did rapid deployment. We really upscaled what we were doing to support all of these teams, and it transformed the way we delivered and the NHS delivered. And we've supported the vaccination program, the response to the pandemic. Throughout the pandemic, you heard a lot about homelessness and helping to get people off the streets. That was coordinated through FutureNHS. So it's had a lot of benefits.
Yes, the FutureNHS was responsible for a lot of the work done in London, the homelessness. Tell me, you mentioned you had a wonderful female boss earlier, and I'm hoping you could describe her activities and her influence on your life, and also women's network in the NHS, exactly how that works. Would you mind talking about those two things? Absolutely.
So I've been really fortunate throughout my NHS career. I've always had female bosses, and I mean, that's no surprise because the NHS is made up of a predominantly female workforce, so you'd expect that. But I've been really fortunate. You know, all of my female bosses have been great, and so I've got to come upon all of them. My first boss, Liz, she was lovely. She really believed in me. She really gave me opportunity. She really challenged me. I came in reasonably junior into the NHS, into an administrative role, but I was given opportunity to actually use the skills I had. She could see what I could bring and actually give me the opportunity to use those skills and develop me further. And that was fantastic. I then got a promotion, and I left that team reasonably quickly, but that was a benefit because I could go on to other things. So Liz was fantastic. I must also say my line manager, my boss now, a lady called Polly. I met Polly at the very start of my career as well. So Polly has been throughout my career and in and out, and you often find this in the NHS. And Polly now, and she's the, I suppose, the founder of FutureNHS as such, our founding mother, as I would call her. And again, she's a very inspirational leader in the NHS. She's another young female leader like myself. She's incredible, and she does a lot for representing for strong young female leadership and kind of changing that.
Would you tell me something about the women's network in the NHS?
So I've recently just stepped down from co-chairing the women's network in the NHS. Again, another position that I was incredibly privileged to hold. And I co-chaired for 18 months the women's network in the NHS alongside another couple of colleagues, Julia and Rachel. Absolutely fantastic role to be taking on. A lot of challenges, and it's a big role to take on in terms of the time that you have to spend and the issues that you're facing, and you take it on knowing that you want to be there to support those women across the NHS and across NHS England with the challenges that they may be facing. And that ranges from everything from queries about going on maternity leave to the menopause to career development, training, all aspects of that. And we came in and myself and my colleagues as co-chairs, we had a real ambition to be able to support women in NHS England and the wider NHS to be able to have a safe space where they could come together and they could chat with other women and they could share experiences and seek support. We could put on particular events to support their career development. They could hear from inspirational other women leaders. So we did monthly speaker series, so you could hear from other senior females to get inspiration and support one another. We created safe spaces where women could come in and they could talk about sensitive topics and they could have that safe space. We created an environment where women could come to us, women and allies as well. I want to say we were open to allies as well. They could come to us as an executive team and they could share any problems or issues they have and know that we would try to address that and we would try to help escalate and support them through that, or even just be sometimes people just wanted someone to listen and to understand. So that was a fantastic role to be undertaking.
It was a wonderful thing for the National Health Service. Now, Alice, you've just talked about a wonderful project that you've done on integrated care systems. Could you tell me something about that, please?
Sure. So in my team, so I have another lady. I'm fortunate I've got other fantastic females and males in my team. I've got a fantastic team of people who are great. And we have a user researcher lead in the team, a lady called Marianthe, who has led on a piece of work which was looking at the collaboration maturity of integrated care systems, the 42 integrated care systems within the National Health System. And the purpose of this piece of work was to actually understand and baseline where are those systems at with regards to actually how well are they working together, what tools are they utilizing to actually collaborate and work well together, where are the gaps, where is there an opportunity for FutureNHS, but also just to understand how they should be working together and communicating better, what are their needs. So this project took several months, and there was user interviews from across at least 15 of the different integrated care systems, so a wide kind of diversity of the integrated care systems. And that was a mix of, senior level chief medical officer through to project manager. So we had a variety of levels and a variety of people who were using the platform, but also who are just generally maybe using other tools of virtual collaboration. And at the end of it, a lot of what I talked about earlier about kind of this fragmented IT systems and different communication channels and aspects such as digital literacy, these were all the things that we found were findings that were coming up, that were the challenges that these integrated care systems were finding with regards to how do they better work together, how do they collaborate better together. So in FutureNHS, we have developed a collaboration blueprint, and this is a tool that we are refining at the moment, and it's something that we want to be able to use alongside and help the ICSs to use to be able to support them to understand where are they in terms of their collaboration maturity and their collaboration journey, what support might they need, where might FutureNHS come in, how can we then come in and help them, and how can we tailor our support to help them get the best out of working together, because we know that when you work together and when you share that information, that results in better outcomes.
Alice, is this work going to be published at all?
Yes, it will be. Yeah. I don't know when. I don't have an exact date yet. We're just finalising those bits and bobs at the moment, but imminently we're at the final stages.
Are there other platforms that FutureNHS are going to develop that are going to create this sort of collaboration between integrated care systems or researchers, for example?
So within FutureNHS, when we've been looking at actually what's our business plan, what is our aim now? Yes, we've got, we're growing 360,000 users, but we recognize that for us, it's not just about growing in number, but it's also about how do we grow our impact as well. So how do we actually turn those numbers into actually doing something more meaningful, and actually what does that mean? So We have some big pieces of work going on at the moment about how we support a lot of the national programmes of work in NHS England to get better use and understanding out of FutureNHS, but also coming out of this research that we've done with the integrated care systems, how do we actually get them to help them and support them to use FutureNHS and use it, recognising it is a free central support tool which comes with a team that can support you to do what you want to do. How do we help you to use that better to meet your goals, to help you work with and across your system and the other systems around it? So that's some kind of key work for us. I think it might be worth mentioning as well, I know we've touched on this previously about a report that we've had commissioned as well by a company called Agile Elephant, and this is we've had an evaluation report. So in sort of back in the early days of FutureNHS, around 2017, we had an evaluation report done to assess our effectiveness, our return on investment and aspects like that. I recommissioned this piece because we've moved on a lot and we've grown a lot, and I wanted to see where we've got to. And again, we're due to be publishing that soon. We're just in the final stages of finishing that off now and finding the findings of that. But that is showing some really, really interesting and I would say impactful insights in terms of the actual the cost savings, the return on investment that the NHS will see. This is compared to a well-known McKinsey model out there, a McKinsey model from 2013, which looked at collaboration systems and tools. And we've had this report commissioned to look at our return on investment, and our return on investment specifically over the next 2 years, and what that looks like with regards to how much we want to grow, what our ambition is. And we're looking at over £20 million worth of return on investment here. And this is an independent model that we have.
Absolutely fabulous. I'm very impressed with Alice. It's been my absolute pleasure to have you on board this podcast, and I hope I can talk to you again in about 6 months' time about further progress that the organisation has made. I'm very impressed with FutureNHS, to say the least. And I don't think a lot of people in the country know about the organisation, let alone understand its potential and what it's actually achieved, particularly during COVID. I think it was a godsend during COVID for a lot of people that I know in London. So I would like to congratulate you personally for your.
Thank you.
I think the work has been amazing. I'm amazed you haven't been to the Queen's Garden for a cup of tea. Maybe that's in the future, I don't know. So I'd like to wish you all the very best in the future and talk to you again. And thank you for your time today.
Thank you, Stephen.